Hello and welcome to Lit Fitness. My name is Christopher and I'm a doctor of physical therapy. On this channel, we take a look at different injuries and the most likely road to recovery. If there's an injury that you're specifically wondering about, leave a comment down below and we'll make a video. Otherwise, today we're going to be talking about shoulder pain. So our first step here in our shoulder anatomy is going to be breaking down the different muscles that are important for moving the shoulder. The first part we'll talk about, working from the outside in, is our shoulder muscle in general, which we call our deltoid. So there are several different fibers within this muscle, but three main categories of what we typically look at. This is the front of the body, and this is the back of the body. The first one we'll take a look at is our anterior delt. So it's highlighted here in our red. This one's responsible for bringing our arm forwards, and some with trying to bring our arm towards our chest. The next one that we'll take a look at is the one highlighted here in green. So this one here is our lateral fibers, or our side delt that we think of. This one's responsible for raising our arm primarily out to the side. And the last one we typically think of here is our posterior delt, or the fibers on the back of the shoulder. These are responsible for helping to pull our arms back behind us and for rotating out to the side. The next group of muscles we'll take a look at here are what are called our rotator cuff muscles. So people typically think of the rotator cuff as one muscle or one thing, but it's actually 4 different individual muscles that do different movements of our shoulder and help to provide stability as we're doing things like reaching overhead or pushing or pulling or anything like that. So the nice part is all of these are kind of named for their location. So the supraspinatus is above the spine, infraspinatus is below the spine, and the subscapularis is on the underside of the scapula. So it gives us a nice, easy reference for what we're looking at here. So the first and the most commonly injured one that we'll talk about is our supraspinatus. That is up here along this top part of our shoulder. So in this side here on the left, we're looking at the back of a shoulder. So if I was standing with my back to you, you'd be looking at the back of my right shoulder. Now, the supraspinatus is the most commonly injured tendon in the shoulder because if we look at this bony spine here along the shoulder blade, there is a really narrow little section that we call our subacromial space right in through there. Now, what that does is decrease the amount of available space that supraspinatus tendon has to travel and can pinch on it and typically leads to some injury. The next muscle we'll talk about is our infraspinatus. So it's the one that sits here. Its primary job is to sit on the back of our shoulder and rotate things out to the side. So it works in conjunction with that posterior delt like we were talking about here a couple of seconds ago. And it is responsible for some of our posterior shoulder stability, so helping to keep things lined up and in place as we move. The other one that does a pretty similar feature as that is our teres minor. So it's a small muscle, but it sits right underneath it. And it's responsible for helping to, again, rotate the shoulder and provide that stability. Now, if we switch things around and we remove your shoulder and shoulder blade and we look at it from the front of your body, what we'll see is on the front side of the shoulder blade, we have this muscle called our subscapularis. Now, this muscle wraps around from the front part of our shoulder blade to the outside part of our humerus, or upper arm bone, which we'll get to here in a second. And it's responsible for what we call internal rotation, or bringing that arm in towards our body, similar to that anterior delt. What's not shown in this picture, but is another important stabilizer for the shoulder, is the long head of our biceps tendon. So that, if it was visible here, would ride right up in through here and hook into the front top part of our shoulder. So what this does is provide some of that stability. So if you pick up something heavy, it also helps to resist that, as well as it works slightly as a shoulder flexion muscle to help bring your arm up in front of you. Now that we've systematically stripped all the muscles away from the bones, we can see what they actually look like. So the important movers here that we're going to talk about are our collarbone, our humerus, our upper arm bone, and then of course the shoulder blade. So let's start with the collarbone. The collarbone, or clavicle, is responsible for helping to hold on to our shoulder blade. So there's a little section right here called our AC joint. It's our acromioclavicular joint. and that is one of our connections to our arm and our body. So without that, we'd lose a lot of stability and the ability to actually pick things up. The next one we'll talk about is our shoulder blade itself, or our scapula. So it's made up of a few different parts that we'll talk about that are important. The first part is the main body section here. So all in through there is where all of those muscles from our rotator cuff that we just looked at attach and originate. The last one we'll take a look at here is our humerus, or our upper arm bone. So this is the one that our deltoid and all of our rotator cuff muscles attach to provide that movement and allow us to do what we want to do, whether that be reach overhead for something, bench press, weight lift, anything where your arm is moving, it's because it's moving your humerus. So our humerus interacts with our scapula right in this region here. We call this our glenoid, or our glenohumeral joint. This is important because it's a ball and socket joint, meaning that we have a lot of motion, but it's inherently unstable because this part of the ball is so much larger than this part of the socket. So it's great because we get a lot of motion, but again, bad because we lose some inherent stability. But that's why we have things like our rotator cuff to help provide that stability. There are also things like a labrum that sits in on the edge of the socket that helps provide some passive stability. But the primary stability movers of the joint are going to be those rotator cuff muscles. Now, let's take a look at a couple exercises that I like to use for people with shoulder pain when I see them in the clinic. So the first exercise we'll try out is called a shoulder smash. Get a ball like a baseball, tennis ball, lacrosse ball. This is a racket ball, something that's fairly firm, and you're going to place it between the wall and your infraspinatus tendon, if you remember about where that looked like. So it's right on the back of your shoulder. It should be somewhat painful, not agonizing, but definitely uncomfortable. And roll around there for a couple of minutes. It'll help to release that muscle and make your shoulder feel a little bit better. So the next is a standing T. What you're going to do is anchor a band to something sturdy in front of you, and then you're going to pull with your arms straight out to the side, trying to squeeze your shoulder blades. It should look like this. The last one is what I call standing resisted scaption. So scaption is kind of this 45-degree mark that's between straight out to the side and straight forward. So what you'll do is use something like a resistance band. You'll stand on it, and then you'll raise your arm up at that 45-degree mark, pause for a second, and return back down to your side. If you're looking for a personalized program to help out with your shoulder pain, I encourage you to take a look at our website, litfitness.com. I'll leave a link down in the description below. Here I can create a personalized program, and I have an actual shoulder pain 4-week plan for you already as well. If your pain symptoms continue to persist, I encourage you to reach out to your doctor for a full evaluation. If you found this information helpful, please leave a like and subscribe. And again, thank you for watching, and we'll see you next time.